Today, New York City Mayor Eric Adams did something no other city has ever done before. He called social media use among young people a threat to public health.
In fact, the mayor likened the dangers of social media use to using alcohol and tobacco, pointing to dangerous trends like subway surfing. The goal? Shedding light on the hazards of social media use, and then to improve the mental health of teenagers in New York City.
In this evening, to tell us what the city's next steps are and how much of a difference local leaders can make, we have with us Health Commissioner Aswin Vasan. Thank you so much for being with us.
Thanks for having me. Good to be here.
First question for you. Was there any one thing or multiple things that pushed the mayor to make this declaration? And for practical purposes, what does making this declaration allow the city to do?
It's a great question. So your first question is, why did we do this? Well, we're seeing a really disturbing trend in youth mental health. We're seeing unprecedented rates of suicide, suicidal thoughts, anxiety and depression, and we're seeing younger and younger kids affected. Now, obviously, the pandemic has made things worse, but this really started in around 2011 and 2012 when we saw the advent of social media on smartphones become ubiquitous. And so it's clear professional societies, the U.S. Surgeon General, expert groups, parent groups, school teachers, that no one has defined a safe age for social media use for people under adulthood. And so what we're declaring today is that social media is a public health crisis, and it is a toxin, a digital toxin, in the same way that public health fights other kinds of toxins like tobacco, cigarettes, and environmental toxins. There is a public health playbook that we're going to put into play, and today's advisory is the beginning of that process by raising the alarm.
Doctor, send that playbook to us ASAP. I have a 14-year-old. I know you have 3 kids. This is the big worry, the big worry of parents with younger kids these days, because these things are just totally addictive as
100%.
anything else.
100%, Bill. And look, and we're complicit in it too. So one of the advisories one of the recommendations within the advisory is that adults start paying attention to their use, and in particular, their use in front of kids. But the core recommendation is that parents and caregivers really delay initiation of social media use, especially on smartphones and other mobile devices, until the age of 14. Why 14? Number one, the American Academy of Pediatrics, the U.S. Surgeon General, as I mentioned, say there is really no safe age for initiation of social media use. Number two, we know that the years between 8 and 14 are particularly vulnerable years in terms of brain development, social development. And this is when kids are forming their identity, forming relationships, finding their social groups, and diving into devices during those years can be really damaging. And number three is age 14 is a big year of transition for most children going to high school, and especially for New Yorkers, New York kids who are starting to ride the subway independently. So our recommendation is wait till 14, and reassess the data, and also reassess who your child is, or the child you're taking care of is, and their social and emotional development before deciding to introduce social media at that time. And I know that there are parents out there, parents like me, who are already facing this every day in their homes and fighting these battles about screen time and social media use. And what we're doing today is raising the alarm and starting the process of empowering parents to fight back. And this is just the beginning. You're going to see a series of steps we take, action plans, and announcements in the coming days and weeks that will bring this home for New Yorkers.
The cheer you hear are parents, just like you, who want ideas and ways to help this. Thank you very much.